As Central Africa deals with its worst outbreak of yellow fever in decades, families wait in lines like this in Congo's capital, Kinshasa, for potentially life-saving vaccines. The World Health Organization and its suppliers have shipped millions of vaccines to the region to stop the spread, but an Associated Press investigation has found fighting the outbreak has been undermined by mismanagement and logistical mistakes. When the WHO asked who had been receiving the vaccines, they discovered more than 1 million doses had mysteriously disappeared, others ruined by improper storage. There is no treatment for yellow fever, a virus that attacks the liver and kidneys. 20% of patients die.
When I fell ill, I noticed that my eyes and my urine were very yellow.
In the current outbreak, there are now about 5,000 suspected cases and have been at least 450 deaths across Angola and Congo.
Nowadays, there is a lot of illness because there aren't enough vaccines.
Congo fumigation teams spray for mosquitoes which transmit the disease as millions await vaccination. According to hundreds of pages of internal emails and documents obtained by the AP, the WHO is facing the problems it had during the Ebola outbreak of 2014, where more than 11,000 were killed. Dr. Bruce Aylward is the WHO's special representative for the Ebola response.
If there's anything good in the horror of a dangerous outbreak like this, it tested the system and it helped WHO remember, look, this doesn't work, that doesn't work, this is going to have to be addressed. It's better, it's on the right track, it's not there yet.
I'm awfully outraged about what's going on.
Joanne Liu is the president of Doctors Without Borders, which partners with the WHO. She wonders why those lessons weren't learned.
No, I don't think we're seeing a different agency yet. We wish, but we don't. But I think that we face the same institutional roadblocks and I would say slowness of administrative and bureaucratic issues.
The lack of vaccines in the region is now so severe that the WHO has now recommended that doses be diluted to stretch the supply, even though a draft document warned that the strategy should be forgotten because of safety and other concerns.
Using a fractional dose, we think that is going to bring some immunity. The reality is we don't know for how long. And so if we had to pick between the two, we probably would like to give a full dose.
Experts say about 40 million vaccines are needed to extinguish the outbreak. To date, the WHO and partners say they have shipped more than 18 million doses. That leaves about 22 million people still waiting to be protected. Robert Bumstead, Associated Press.